Greetings. You know that morning sickness and excessive salivation, nausea, and vomiting is a very common problem in pregnancy. And women have resorted to using home remedies like bitter cola, licking of sweet, taking of agbalumo, chewing gums to sort out to as remedy for this excessive salivation. Now, a lot of women have asked me to talk about the use of bitter cola in pregnancy, whether it is safe. Now, the question is bitter cola safe in pregnancy? Now, putting in mind that a lot of women use it for their morning sickness. So, is bitter cola safe in pregnancy? The one issue with bitter cola is that it contains a lot of caffeine. You know, caffeine, yes, caffeine. It contains a lot of caffeine. And caffeine has been found truly not to be very good for pregnant women, especially as regards the development of the baby. It has been reported to cause a high level of caffeine has been reported to cause miscarriage, low birth weight, premature baby, woman will deliver before time, and maldevelopment, poor development of the brain in unborn babies. Yes, high level of it. But the research I've done, I've tried to look at books, look at literatures and the rest. There's no study or research or trial that have linked bitter cola to causing all this in pregnant women. There's none. There's no research that have been conducted in pregnant women using bitter cola that have shown that women that take bitter cola for their morning sickness or to remedy their excessive salivation, that these women will come down with miscarriage or will have baby with low birth weight. That means bitter cola is relatively safe in pregnancy. I also saw a research that said yes, that bitter cola has caffeine, but the amount of caffeine in bitter cola is not enough to cause any harm to the pregnant woman or to the baby. So the research even said, advised pregnant women that to go ahead with their use of bitter cola, but it's just that they should use it. They should take bitter cola or eat bitter cola with moderation. That means they should not eat it too much. Do you understand what I'm trying to say? What I'm trying to say is this: bitter cola, yes, contains caffeine. It contains caffeine, and caffeine is not good for pregnant women, unborn babies. But the amount of caffeine that will cause harm to unborn babies and pregnant women has to be very high. But the caffeine in bitter cola is too low, very in small amounts. So it cannot cause any harm to babies or pregnant women. So bitter cola is relatively safe in pregnancy. So pregnant women that use it to bitter cola to take care of their excessive salivation, their nausea, their vomiting, can go ahead and have bitter cola and use it. Some women don't even chew it. They just want that bitter taste in their mouth to dry up their mouth. So some will just put it in their mouth and leave it there. The bitter taste will help dry up the mouth and reduce the excessive salivation. Some don't even chew it. Some even chew it and don't even swallow it. And that's the truth. That's what most of them do. Some even chew the bitter cola, they don't even swallow it. They just chew it to dry up their mouth, then spit it out. That's what they do. So bitter cola is not bad in pregnancy as widely rumored. Bitter cola is relatively safe. The truth is that don't use too much of it. Don't take too much of it. You should not eat like 20 seeds of the bitter cola in a day. Highest, take 2 seeds or 3 seeds. That is okay for you. That one you have taken is not enough to cause harm to your baby at all. Bitter cola is safe in pregnancy. It's true that it contains caffeine. Nobody is arguing that. But the caffeine in bitter cola is not enough to cause your baby to come out, it's not enough to cause you to have miscarriage. It's not enough to cause any birth defect in your baby. Do you know that even the coke you take has caffeine? Has it caused you any harm? So that's the truth. The caffeine in coke is also in small amount. That's why it's not causing you any harm. Any doctor will tell you that if you want to drink coke, drink coke. It's the same thing. It's not that it does not contain caffeine. It contains caffeine. But they still tell you go ahead, drink coke if you want. So same thing with bitter cola. If you want to eat bitter cola, go ahead and eat bitter cola. Mountain Dew, all those drinks, most of those tea you take, don't you know they have caffeine? Have they caused you any harm? No. So go ahead and take your bitter cola, but don't take it too much. Bitter cola is relatively safe in pregnancy if it's taken with moderation. Don't take it too much. Just take small of it if it's, you are having excessive salivation. See, that excessive salivation, I think medicine have not really talked about it in detail. So they have not really looked at it. It's a big problem in pregnancy. Imagine a woman will have a spitting bottle, carrying spitting bottle around. Some by their bedside, they are spitting. They have a spitting basin. Some have spitting drum. They spit a drum of saliva per day. Sometimes they will spit and spit and spit. They will be dehydrated. So if bitter cola is giving you symptomatic relief, go ahead and have it. Take it, but take it with moderation. Some of you, what you do is just put it inside your mouth and leave it there, and it will give you some relief. If you cannot make do of bitter cola, take agbalumo. Even kola nuts, if you want to take kola nuts, it's also fair, but don't use it excessively. That's what I'm advising you. Hmm? Do you? I know that I've been able to educate you on this. Bitter cola, yes, has caffeine, but the caffeine in bitter cola is not enough to cause you harm or that or your baby harm. It's not enough to cause your baby any birth defect. You understand? Do you have any question? Do you have any doubt? Oh, please put it in the comment section. Put it in the comment section so that we can talk about it. Thank you.